What blood pressure level can cause a stroke? Have you ever felt that your blood pressure is just a number? I know how that feels. Even a small rise above 140/90 quietly strains the tiny vessels in your brain, affecting speech, balance, and independence. The good news is you don't have to wait. Simple steps help. Check your pressure each morning. Take a gentle walk or keep water and your pills nearby. You deserve to feel clear, strong, and in control. Try tomorrow. One small action today can protect your brain and your independence for years. Here at Senior Health Tips 365, I'll be sharing practical, easy-to-follow tips to help you take control of your health and live well every day. Go ahead and hit the like button and let me know where you're watching from. I'd love to understand your needs better so we can help you more. Understanding high blood pressure and stroke risk. Have you ever sat in your doctor's office and they read your numbers, 140/90, and you wondered, is that really dangerous? Let me tell you, that's the line where we start to worry about high blood pressure. At home, we use a slightly lower threshold, around 135/85. And if you've ever worn a 24-hour monitor, we look closely once the average is 130/80. These numbers matter because they tell us how much pressure your vessels are facing every single day. Now, many people ask, does this change as I get older? You might think the target goes higher with age, but that's not really true. Your body may tolerate some variation, but once you cross that threshold, the risk of stroke becomes very real. How high blood pressure triggers a stroke. Let me explain it simply. Think of the pipes in your house. If the pressure builds suddenly, one of them might burst. That's like a hemorrhagic stroke, bleeding into the brain. I've seen it happen, and it can take away speech, movement, or even life in an instant. But there's another danger that creeps in quietly. When blood pressure stays high for years, it wears the vessels down. They get narrow and stiff, almost like a road filled with cracks and debris, until one day, a clot blocks the way. That's an ischemic stroke, the most common type. And here's the part that worries me most. Some of my patients stop their medications because they feel fine. Others keep taking an old prescription without checking in or even borrow a pill from a neighbor. I know it feels harmless, but that decision can be the very thing that triggers a stroke. So what can you do? First, never adjust your medicines without talking to your doctor. Those pills aren't just numbers on a label, they're your shield against a silent threat. Second, check your blood pressure regularly. You don't need fancy machines. A simple home monitor can guide you. Here is an easy step you can start tomorrow. Keep a small notebook by your bed. Every morning before breakfast, write down your reading. Over time, you'll see the pattern, and that helps both you and your doctor make the right decisions. And please remember, you deserve to feel strong and clear-headed. Protecting your brain is not about fear, it's about freedom. Freedom to walk, to talk, to enjoy the people you love without the shadow of stroke hanging over you. Take it one small step at a time. Drink a little more water, move your body gently, take your medicine as prescribed. I've seen people add years of healthy life this way, and I want the same for you. And stay with me in this video, because in the next part, I'll share something simple, something you might not expect, that can make a big difference for older adults. Recognizing and responding to stroke symptoms. Have you ever thought high blood pressure only belongs to older people? That idea is dangerous. I've seen many younger adults skip checkups, and by the time they notice symptoms, treatment becomes much harder. You deserve to feel safe. So even if you're in your 30s or 40s, take a few minutes to check your blood pressure. It's simple, like brushing your teeth, but it can protect your brain and heart. Now, let's talk about stroke. Whether it's an ischemic stroke or a hemorrhagic one, the early signs look very much the same, and catching them early makes the biggest difference. There's a simple way to remember it. FAST. F for face, look if one side is drooping. A for arms, see if one arm drifts down. S for speech, notice if words sound slurred. T for time, call emergency help right away. Time is everything. I've held hands with families who wish they had called sooner. Even 5 or 10 minutes can change the outcome. If you see the signs, don't wait. One important warning. If your loved one has high blood pressure and shows stroke symptoms, please don't give them their usual medicine on your own. It may cause more harm than good. In bleeding strokes, lowering blood pressure helps, but in clot strokes, lowering it too fast can cut blood flow to the brain. That's why doctors must decide. Never handle it alone at home.
So what's the right first step? Call for emergency help immediately. While waiting, lay the person on their side, loosen tight clothing, and note the exact time symptoms began. If they stop breathing and you know CPR, you can help until the ambulance comes. And if they take medications, bring those along. It helps doctors act faster. We often talk about the golden hour. For clot strokes, treatment can work best within the first 4.5 hours. Sometimes doctors can extend it, but every minute lost is brain lost. For bleeding strokes, it's the same. The sooner we can stop the bleeding and control pressure, the better the recovery. That's why you should always act fast. Don't second guess. So here's what I want you to remember. Check your blood pressure, learn the FAST rule, and never delay when you see warning signs. Try it tomorrow. You can even teach a family member. You deserve to feel clear and strong, and the people who love you deserve to see you safe. Stay with me in this video because the next tip is simple, but it may surprise you how much it helps. If you feel some of these signs happen to you, just type number 1 in the comments. If it's your loved one who has them, type number 2 and send this video to them. That way, you're not only helping yourself, but also giving someone you love a chance to check and stay safe. Sometimes one small action can make a very big difference. Why stroke can still happen and who is at risk? Have you ever wondered why someone can still get a stroke even though they take their blood pressure medicine every day? I know that feels confusing. You do the right thing, and yet the worry is still there. The truth is, blood pressure medicine helps a lot, but it cannot give you a 100% guarantee. Your body, your age, your other health conditions, they all play a part. For example, if you also have diabetes, kidney problems, or high cholesterol, then controlling blood pressure becomes harder. As we get older, the body handles salts and hormones differently, and some medicines don't work as strongly as before. But here's the good news. When you combine your medicine with healthy daily habits, you lower the risk in a big way. Simple things like eating less salty food, walking a little more, and keeping a regular sleep routine, these really matter. One mistake I see too often is stopping medicine just because you feel fine. I know it's tempting, but high blood pressure is a silent problem. It damages quietly, even when you feel strong. Another thought is, if I take the pill, I don't need to change my lifestyle. But medicine works best as a partner. It needs your diet, your activity, your daily care to protect you fully. So if you live with high blood pressure, stay consistent. Check your numbers, visit your doctor, and don't use old prescriptions without review. You deserve to feel safe and strong tomorrow, not just today. But knowing why strokes can still happen is just the beginning. What if I told you that there are simple daily habits and small adjustments that can make a huge difference in protecting your brain and heart? In the next part, we'll explore practical, easy-to-follow ways to lower your risk without overwhelming your day. Even a few small steps can add up to years of healthier, stronger life. Prevention and family preparedness. You know, high blood pressure is one of the biggest risks for stroke. It's quiet. You don't always feel it, but it can change everything in just a few minutes. That's why I always tell my patients, keep a simple blood pressure monitor at home. Check it often, just like you'd check the lock on your door before going to bed. It gives you peace of mind and it keeps you safe. And make sure you always have your medicine nearby, not in another room, not in the car, right where you can reach it. Because missing just 1 or 2 days can raise your risk without you even noticing. There's also something I want you and your family to know. If someone's face suddenly droops, if their words sound strange, or if one arm feels weak, that's a stroke warning. We call it FAST: face, arms, speech, time. If that ever happens, don't wait. Don't hope it will pass. Call emergency right away. Every minute matters. The sooner you act, the better the chances of recovery. So let me ask you, do you have these things ready in your home? A monitor, your medicine, and a plan if something happens? If not, just pick one of them to prepare today. You deserve to feel safe. You deserve to feel strong. Even small steps like these can protect you and the people you love in the moments that matter most.
Now, I'd like you to do one small thing. Comment below one action you will take today. It could be checking your blood pressure, taking your medicine on time, or even reminding your spouse or parent to drink more water. Write it down, because when you make it real, you're more likely to do it. And remember, every small step you take today is a gift for your tomorrow. You've spent these minutes with me, and I want you to use them well. Don't just listen. Take one small step today. Check your blood pressure when you wake up tomorrow, or take a short walk after dinner instead of sitting down right away. Simple actions like these, they build up over time. They keep your mind clear, your body strong, and your family less worried about you. You deserve to live these years healthy and happy. So please, look at yourself, make one change, and hold on to it. And before you go, don't stop here. On the screen, you'll see a playlist made just for you, Senior Health Tips. It's a collection of simple, practical lessons I've prepared for people over 60. Each video is like a gentle reminder, helping you live stronger and be a true inspiration for your children and grandchildren. So turn on your TV, let the playlist play in the background. Every day, you'll pick up one more thing that keeps you safe, calm, and healthy. Stay with me there. I'll be right beside you in the next video.